So thank you so much, and thank you, ISNTD, for this invite and giving me an opportunity to discuss the innovative point-of-care diagnostics which we have been developing over the past couple of years for infectious diseases. And here I would like to touch specifically for neglected tropical diseases. So we learned this morning and also yesterday the global spread of NTDs, and need not mention that how it has been affecting the populations all across the global south. So the global cause for such a spread of neglected tropical diseases, and as also that Zoom highlighted this morning, is because of the lack of access. So these populations live in these remote locations highlighted in these pictures, and they have to walk or across like distances as high as we learned 20 kilometers in 2017 for VL diagnostics, and 10 kilometers it is changing and getting better. Why? Because the diagnostics happen here. They happen in the facilities, and where we need a confirmatory diagnostics using microscopy as a reference tool of the classical for diagnosing what exactly is happening there for NTDs, and also requiring inpatient in order to have an effective follow-up, so that the patients do not go away in between the treatment and the diagnostics. So what we need to do is actually to bring the diagnostics to the doorsteps of the people. While the efforts have been done also by FIND, we learned this morning that the screening days and the diagnostic tests are brought to really at their doorsteps, but the gap still exists. The gap exists between the confirmatory diagnostics and the treatment and its access to the people. And therefore, to highlight what exactly is the global diagnostic need for NTDs, it is a test which is accessible, both in terms of sample collection, that is, it should be user-friendly for the end users to collect the samples, and applicable, it should be robust and deliverable. We learned today that accessibility is the biggest problem when it comes to diagnostics. The test has to be differentiable, both in the case of overlapping symptoms, and also working across different geographies. We learned also from the case of VL that certain testing works better in India and in comparison to Africa. So these differences are major, and therefore the problems coming up from this differentiability of the test, this results in the delayed diagnostics and delayed treatment. At the same time, these diagnostics tests has to be expeditious, both in terms of implementation and results. So especially when it comes to confirmatory diagnostics, when we're using microscopy, all these tests, when we are trying to make a smear out of it, the results aren't that rapid. It takes from hours to days to recognize if that's the disease and confirm if that's the disease. So it should be easy and rapid for confirming the disease at the earliest. At the same time, we need to attach our diagnostic test for easy monitoring and evaluation, so as to find out what could be the efficient treatment, and also for the data surveillance to understand that what is the real need of the diagnostic test, what is the real need of the treatment. So it has to facilitate a disease management, distinguish between asymptomatic carriers so that we can control the transmissions. And so owing to the fact of globalization, and as Cameron has been pointing out the word COVIDization, we have realized that the diseases are no more confined to certain geographies, and they're no more endemic, they're actually spreading across. In order to control the transmission, we need to also recognize the asymptomatic carriers, also animals in this case, because they are also the carriers. And last but not the least, it should have been a sustainable solution, both in terms of affordability and cohesiveness to the treatment. So as the Zoom highlighted this morning, that often these tests are expensive and therefore difficult to attain. So we have to have these tests brought to the people, and at the same time make them affordable and should be cohesive to the treatment. So having realized this is exactly the diagnostic need, I would like to present a sensor which requires just a sample and an answer out capabilities, which is for a direct DNA detection. So owing to direct DNA detection, we provide fast and accurate diagnostics, which is coming from the classical CRISPR-Cas9-based precision and CRISPR-Cas9-based technology, which I will discuss in the coming slides. At the same time, this test can work as a rapid confirmatory test. So you need not administer an RDT in the field and then perform a confirmatory test in the facility. So this can serve serve as a rapid confirmatory test because it is using DNA of a pathogen, which is specific to the pathogen. And last but not the least, it is a simple and easy to use test considering the point of care diagnostics requirement. The test has been modified and designed in the way. So if I look into the R&D involved in this development of this test, it is the CRISPR-Cas, the hottest gene editing tool on the block. So we have repurposed this gene editing tool, which actually precisely locates a set of sequences in a plethora of DNA, in a pool of DNA. And it is indeed a very specific and sensitive system. It even earned itself a Nobel Prize in chemistry last year. So it has been the talk of the town since all this while. And what exactly is we're doing? We're using, actually, we are exploiting this CRISPR-Cas precision for diagnostics. So if I was to explain in the layman term, it is like going with a scanner onto the human body and then looking for a specific set of DNA, here highlighted in the green. And then the sensor is able to recognize this DNA from your biological fluid. We can also adapt it. It's an adaptable technology, so giving a different code to it. So down the different barcode to recognize in the body, and it can recognize a different barcode then. And also it is multiplexable, the need which we recognized that it should recognize more than one type of pathogen, so especially as Fabiana highlighted yesterday for VL again, that we should have HIV, we have HIV co-infection. So and the treatment strategies are different when there is a HIV co-infected VL patient. So if you could co-diagnose simultaneously with a VL and HIV. So all this is possible with our CRISPR-Cas-based diagnostics. So what exactly it means for an end user, that you provide a blood or a urine sample, and then you administer it into the test. And the rest of the thing goes internally, which is invisible to the eye of the user. So this works as a lab on a chip platform where we utilize a strategy to specifically extract the DNA from the sample, and then we perform isothermal DNA amplification, followed by the CRISPR-Cas-based binding and providing a result. So as of now, this test works in the lab setting, giving positive and highlighting it as a green when there is a positive sample. So when the patient sample has been, in this case, stimulated with the VL DNA, it showed green color. And it was faint. You cannot see, there is definitely a liquid there. It's not an empty tube highlighted here. So it goes to no signal when there is no pathogen DNA present. And we aim to further connect this diagnostics into a digital readout so that it just gives a yes/no answer, so that minimizing the user interpretation. And at the same time, we aim to connect it to the connected diagnostics, the hot topic again, so that we can facilitate data surveillance and data management. So having said so, we realized that the importance of data surveillance and data management. We also realized that the R&D cannot just happen on its own. It has to happen in context to the place it will be placed eventually. And therefore, during the development of this project, we also worked on something called Concept Target Product Profile, CTPP, something prior to the TPPP, which the WHO provides. So this is kind of an easy tool, and I will go deep into it to discuss what exactly I mean. So it's an easy tool where the context analysis can be performed by the researchers themselves. So they get into the field, and so that they do not develop a test in North, which will not see the light of the day in the global South. So what exactly it means that you discuss it with the end users, you discuss the test requirements, you discuss with the diagnostic algorithms with the lab technicians, the community health volunteers, the community health and midwives. So these are the people who are actually administering the test in the field. So you talk to them, you underline what are the bottlenecks, what are the drawbacks of the existing system. Maybe you need not have to develop a test and just make it the existing test available and accessible in certain cases. So there's a whole There's a different thing between development of the science and providing it to the field. And if we can join these two together, we can develop better therapeutics and better diagnostic algorithms for neglected tropical diseases. So in our work, we went into the field, we try to understand what exactly is a patient journey from their local communities when they have the first onset of these symptoms. How do they eventually take it up to the treatment facilities? What is the requirements? What is the follow-up requirements? What is the requirement from a patient point of view? What is the requirement from healthcare provider point of view? And with doing so, we then actually formulated the requirements for our test while we were developing the test in the laboratory here in Delft, and giving us the opportunity to have some key characteristics into our test, that it should be field deployable, it should be multiplexable. Specifically, it should provide the test of cure, and it should be a confirmatory diagnostics, because we do have an RDT for multiple neglected tropical diseases, but they often fail because they are in the confirmatory diagnostics. So there has to be done another test back in the facility when they have an infection. So the confirmatory diagnostics are redone in order to confirm before the expensive treatment is administered onto the patients. So having said so, I would like to present our sensor for tropical and neglected diseases. We call it STAND, and with the aim to bring diagnostics to all. It's a platform technology which we're developing specifically for NTDs now, but it can be also repurposed for other diseases. Just it's waiting for the investments. So we're looking for the investments and eventually developing our test for other diseases, other infectious diseases. With this, I would like to stop and say thank you and acknowledge the team which has been involved in the development of this test, and our partners who provided funding for the development of the test and also the resources to conduct the context analysis study. Thank you for your time, and I'm open for questions.